way we treat our specialty programs is, and actually it's any program, is to make sure that it is going to work in any managed care scenario. It's important for all drugs. It's especially important for launch drugs because there's a 6 to 12 month period post-launch, when the after FDA approval, when payers are really trying to figure out what the product is, how are we going to cover it, especially if it's an injectable or an infusion drug. So there's a period of time in which managed care might switch the benefits from pharmacy to medical or medical to pharmacy and put different types of hurdles in place. So the ConnectiveRx programs are going to work regardless of how managed care is covering the drug, regardless of the managed care companies or the payers change how they're covering the drug, regardless of whether a patient changes jobs, changes insurance. So the platform that we have is going to collect all of the data about a patient when they enroll in the program. And an ID is assigned to that patient at that time. Regardless of any changes in managed care coverage, that ID is going to stay with the patient throughout their time on therapy, throughout their time on the program. So that is really key. And the reason it's key, especially for the brand, is because we're going to be able to follow that patient throughout their time on therapy and provide very, very valuable data to the brand. So they're going to know what's going on with their patients, what's going on with their providers, and what's going on with their payers. So I would say one of the biggest distinctions is that single platform, that single ID that stays with the patients. And then also another key differentiator is the wealth of data that we make available to the brands. A tremendous amount of data is collected with each claim. And so we're able to provide that data to the brand as pure raw data if they want. But we have a great portal. So anybody on the brand team can access the information about the program 24/7. The reports are very, very comprehensive, and they also have tremendous drill down capability. So I would say that the advantages of ConnectiveRx programs are in that single platform, in that single ID, which makes the patient journey very, very smooth. Patients don't have to re-enroll if something changes. And then also the wealth of data and how we present the data, make sure it's very meaningful to the user.